words like triggered and gaslighting are ones that we're really hearing a lot in everyday society right now, but what are the impacts of using what's called therapy speak in such a casual manner? I'm joined once again here on Evening Plus by licensed professional counselor with ThriveWorks in Portage, Heather Crampton. Heather, thanks so much for coming back to talk about another therapy-related topic. I'm so intrigued by this topic because we do hear words like the ones I mentioned quite often. As far as someone who may not be aware of why those words could be hurtful or potentially, difficult for someone to hear, why are we talking about this? Why is this needed?
Because recently in our culture, we're learning that people are using therapy talk in everyday language. We're seeing it show up online. We're seeing it show up on mainly things like TikTok, Facebook, Instagram. And a lot of people use these words to describe how they're feeling because it connects the person with the word and they're able to describe with, kind of one word about what's going on, which is a great thing. However, sometimes the words are used as weaponized things. So if you're not really sure about the context of the words you're using, you could actually harm somebody or even shut down a good conversation with just one word.
Are you able to give us kind of maybe an example? I know some of the words we talked about, triggered, gaslighting. I know before our interview started, when people make references to, oh, I'm so OCD can be one.
Yep.
And of course, also any casual references to the topic of suicide can be very difficult.
Absolutely.
How can these kind of play a role, as you mentioned, into having an emotional impact on someone?
You could be having a conversation with somebody and say you disagree with what they're saying. Maybe they're talking about a particular topic that you just don't agree with. And a word that would stop that would be "you're gaslighting me," because gaslighting is a term that's it's a diagnosable thing. When you're gaslighting somebody, you're basically making them question their reality. You're telling them, "Oh, I didn't say that," when they know that you did, but you're so charismatic in what you're saying that they start to question, well, did they say that? Did they not say that? Another word is narcissist. That gets thrown around a lot because maybe somebody is a little bit too much into themselves, so they get that term narcissist. And instead of opening up that conversation and saying, what you're saying and doing is making me feel a certain way, you shut down that conversation by saying, oh, you're just a narcissist.
Yeah, so it's, some impacts of using a word that maybe not everyone realizes is what's going to come of including that in a conversation.
Exactly.
And so if folks are watching tonight and they're thinking, oh man, I've used some of these words before. I didn't mean to hurt anybody. What's a better way to approach, a conversation where maybe you were using a word like gaslighting or triggered or something and you want to approach it in a different way?
So we'll use, let's say, boundaries, for an example, is a good one that gets thrown around a lot. We use it a lot in therapy. We talk about boundaries because boundaries are meant to protect your well-being, not to harm anybody else. However, sometimes a lot in a conversation, somebody might say, I'm going to create a boundary of not talking about this when we're together, and the other person could feel like, well, you're just trying to control the conversation or control what I say or do. When in reality, the person A is saying, no, I'm putting a boundary on that because it's protecting my mental health and probably our friendship if we don't talk about it.
Yeah, there's just, more to the conversation that may be happening with use or, lack of those words that someone might not just realize basically when they're using them or hearing them.
Exactly. And words like gaslighting we were talking about, that's an intentional manipulation. Just because you dislike something that somebody is saying doesn't mean they're gaslighting you. Or just because you had a really bad date, it doesn't mean that you were traumatized. So a lot of people I've noticed do use trauma as a huge word. I was traumatized just because they were uncomfortable in a situation, not because they want to act differently or say something bigger than what it is. They just don't understand the context of the word, so that's what they use.
Yeah, and for someone who has actually endured some sort of trauma or, considers themselves to have been traumatized in some way, to hear that kind of tossed around, oh, I had a bad experience at the grocery store, it left me traumatized, that could certainly, be jarring for someone to hear.
Exactly, because trauma is a psychological injury on your brain, and things like trauma can be imprinted the day you're born, actually. It can be imprinted before you realize it. That's why we have adults that come to therapy and say things like, I didn't even know that this was something that was affecting my life. I didn't know that that could do that. And so, during therapy we use different treatment modalities. Trauma-focused cognitive behavioral therapy is one. Eye movement and desensitization and reprocessing, which is EMDR, is something that I do on a daily basis with my clients. And so when somebody hears somebody say, I was traumatized by this bad date, when they were actually maybe in a shooting or something like that, that tends to minimize the word trauma, such as other words like gaslighting as well.
And I know we briefly touched on this, but I think using obsessive compulsive disorder, OCD, is one that's kind of used very casually. I personally deal with that disorder. And so when I hear that, I cleaned the house extra, this weekend, I'm so OCD, that's, for me, I can kind of attest to what you were saying, is it's kind of like, okay, well, that's not really how it works, and it kind of makes me feel silly, or kind of like, willy-nilly, I must just be, super tidy, when in fact it can be so much deeper than that for someone with OCD.
Right, somebody who has OCD, true OCD, it's not a matter of preference that they like things a certain way. If anybody asked you, you would probably say, I would give you my OCD if I could.
Yeah.
It can be very debilitating for people. I mean, to the extent that they don't want to leave their home because of it, because there's safety behaviors that they do that just become tiring. It's exhausting.
Yeah.
Especially the OCD type that are in your thoughts versus behaviors. You have OCD in the way that you're thinking, where you're counting constantly, you're repeating constantly, and that can be exhausting.
And so in that circumstance, hey, an alternative might just be, I spent the weekend cleaning. I love when it's really clean. I love to have things tidy. That brings me peace. Something like that would be a great alternative.
Exactly. I don't work in the office on Fridays. I use Fridays to clean my home. And my kids and my husband will tell you every single time I'm done, I say, I love living in a clean house. But I'm not OCD about it, because Friday's the only day I do it.
Yeah, definitely. Okay. Any other things to touch on with this topic? I so appreciate you giving these examples and kind of breaking down, I think something that many people don't think has any harm or repercussions, but in fact could. And it's not that anyone's doing it on purpose, but it's something just to think about when you're moving forward with conversations.
Right. I mean, a good thing to do is ask yourself, if what I'm saying, is that going to harm somebody? Am I using it to harm somebody, or am I using it to protect and help myself? And if things become too complicated, it's a good time to seek therapy to maybe understand how you're feeling.
Yeah.
If you're not understanding the context of your words, that might be a good time to ask a professional, say, what does this mean when I do these certain behaviors, when I say these certain things? And it could be a very diagnosable thing. Like narcissism, that is a personality disorder that's diagnosable, and people who struggle with narcissism would tell you, I would gladly not have it. Because these thoughts are intrusive.
And I think it's a good lesson, this whole conversation, just that you never really know what someone's going through.
Exactly.
You never know what they may have been through in the past before you knew them, what they're dealing with that day, what challenges they have at home outside of, work or wherever you're hanging out. So just good to be thinking about,
and
thinking
asking
about it that
questions, always asking questions.
Heather, thanks so much for being here again and talking about this. I so appreciate it.
Thank you for having me.
We are going to take a quick break. We'll be right